Okay, thank you so much. So the type of the ultrasound probes actually depends on the types depend on so many things. So we'll talk about the frequency, is it high or low? So it's very important when you want to scan. You know that for example, this is a volume probe we use for 3D, 4D, uses low frequency. Curvilinear, this is low frequency. But when you see linear probes and intracavitary probes, those ones are actually they use high frequency. They have high frequency. So depending. So when using any of these probes, you'll be able to note. Actually, it's very important to know the penetrability, the frequency, penetrability, and the resolution. These are very important. And as I said, the ultrasound probe, the major components of ultrasound probe are the piezoelectric crystal elements. These are so this is usually the most important part of the ultrasound machine or the ultrasound probe. So these elements that send out sound waves and receive echoes. So these piezoelectric crystal elements are very important. And because it's very important, it's covered with so many things. They're covered with the ground electrode, we have the matching layer and the lens. These are important, so it's covered. So this is why if the piezoelectric crystal is damaged, the probe becomes useless. So it's very important. That's why the probe must be handled with care. Probe must be handled with care because once there's a damage in the piezoelectric crystal element, the ultrasound, the probe becomes has to be replaced. So it's very important. I'm going to talk about this, the different types of probes. So this is the one that actually, if you're doing ultrasound of the pelvis or the obstetric ultrasound, this is the most important probe that is that we really actually need is the curved array or curvilinear probe. This one uses low frequency. That's large scanning area. As I said, because it's low frequency, losing resolution with depths. It has better penetration. But in depths, in the depth, it has reduced resolution. Then we have the linear probes. When you say a linear probe, usually uses high frequency. So usually used to scan superficial structures. So it is a probe of choice, and for example, vascular access, vascular access, patient with dialysis or whatever. So it is what is used, vascular access for ocular, ultrasound of the muscles or the hands. So if you don't need to, actually, if you don't need depth, the linear array probe is very important. Then we have endocavitary probes. Endocavitary probes could be the transvaginal ultrasound, it could be an intraoral ultrasound. This one usually have, so the penetration is usually of high frequency. This is what we use using transvaginal ultrasound, usually in early pregnancies. So because it's high frequency, it has good resolution, but it cannot penetrate much. And the reason why it is, we always ask patients to empty and not penetrate much. And once the bladder is full, we will not be able to see the uterus because it can displace it. So this phase array probe, usually, this is what is used by the cardiologist. It also uses low frequency, so has loss of resolution with depth. So this is what is used by cardiologists. So how are ultrasound images produced? As already said, the piezoelectric crystal is the most important part of the component of the ultrasound probe. So once the sound wave is sent through the piezoelectric crystals, so what happens? Electrical energy to ultrasound wave, which is sent to the tissue. So ultrasound waves, the transducer converts electrical energy to ultrasound wave, which is sent to the tissue. And as the sound waves travel through the body, it is reflected by the tissue interfaces. And then at the different interfaces, reflected echoes are picked up by the same transducer. And then once the echo is reflected, what happens? The echo is converted to electric signal, and then the machine processes the data and forms a grayscale image. So that is the function of the ultrasound, the probe. The probe sends the probe or the transducer, it converts. So once it's connected, the probe is connected to electrical energy. The sound waves, so sound waves are produced, and the sound waves passes through the body. And then as the sound waves is passing through the body, at different interfaces, it is reflected. So the echoes are reflected. And as they are reflected, the probe detects the sound waves, the echoes, and then it converts the echoes back to electrical signal, and then the machine processes it. And that is what we see on the screen. So the images are seen on the screen. So this is just showing it again. So it's pixoelectric crystals. So the sound waves are actually produced when you apply electric current. The pixoelectric crystal vibrates, and when they vibrate, they send out sound waves. And these sound waves will pass through different objects and are reflected. And then when they are reflected, what happens? The echoes. So the ultrasound, the echoes are reflected. And then the pixoelectric crystals detect the echoes again. And then the echoes are converted into electrical currents. And then images are produced. So that means the probe is both a transmitter and a detector. The ultrasound probes send sound waves and it detects the echoes. So to create the ultrasound process, so this is just showing us how ultrasound images are produced. The piezoelectric crystal, so that's why it's very important. If the piezoelectric crystal is deformed, it will disrupt the sound wave that is passed, that is being generated, and this can affect our images. So that's why ultrasound must be, the probe must be taken care of. So the probe or the transducer is both a transmitter and a detector. So there are different modes of ultrasound. We have the A mode, the B mode, and the M mode. So we have the scale modes. Some just talking about this. We have the scale modes, then we have the Doppler modes. For the scale modes, we have the A mode, amplitude. We have the B mode as a brightness mode, and we have the motion mode. Then we have the Doppler modes. And the modes are continuous wave Doppler, power Doppler, color Doppler, duplex Doppler, and pulse wave. So we'll talk about some of this. So A mode, what's the A mode? We call it amplitude mode. It's the simplest form of ultrasound. It's no longer, we don't use this one for diagnostic. So it's only used in encephalography and ophthalmoscopy. So it's used in EEG and ophthalmoscopy. Usually it gives one-dimensional information. Usually it gives us a depth. For example, ophthalmologists, to be able to actually know the depth of this, because the eye is very small, so it helps to know the depths of the structures, maybe that they want to be operated. So this simplest. And the brightness mode, that is a B mode, and this is one that we see commonly. And brightness mode actually displays. This is let me just say the two-dimensional ultrasound image display is composed of bright dots representing the ultrasound echoes. For example, as I said, as the ultrasound wave passes through the tissue, it is reflected at different interfaces. So the reflected echoes are detected by the ultrasound machine or the ultrasound probe again. So the brightness of each dot is determined by the strength of the returning echo. For example, once you see something that is very bright, that means the echo that is returned is much. When you see somewhere that is a little bit dark, that means the echo returned is not actually much. So the brightness mode is a display of bright dots that represent the ultrasound and echoes. This is very important. We call it brightness mode, B mode, or some machine will call it two-dimensional mode. So it's cool. And it's just showing us the brightness mode again. So the echo that is reflected is what will actually produce the images on the screen. For example, as I said, the bright area means strong echoes. In between, that means the echo is not much. But when we now have a very dark area, we call this one anechoic. That means there was no reflection. So when when the area is very dark, we call it anechoic. So that means absence of echoes. So strong echoes gives bright dots. Very dark echo gives this, we call it black dots, and this shows that there was no echo. So everything else is in between. You can see this. This is in between. This one shows some echoes. Some echoes are returned. Some echoes are returned here, but the bright one means a lot of echo was reflected. That's what makes it very bright. And that shows us the terminologies in ultrasound. So this will help us to actually understand the terminologies. As I said, hyperechoic means high intensity echoes. So it appears very bright. High intensity echoes. Hypoechoic means low intensity echoes. While anechoic means there was no echo. Everything passed through the structure. So it's called anechoic. No internal echoes. And then we'll talk about isoechoic. Usually this is actually used, especially when you're seeing a pathology. So you relate it to the normal structures. So say as an isoechoic, that is what you are seeing actually similar in echo, maybe to the myometrum, or similar in echo to the vertebrae. So that's when you use isoechoic. When the pathology or whatever you are seeing is like similar intensity to a structure. That's when we use isoechoic. For hyperechoic, we also call it echogenic. When we talk about echogenic. So hyperechoic is another name for hyperechoic is echogenic. So something is echogenic, that means it's very bright. Then anechoic is another name for, like another term for terminology for isoechoic is anechoic is sonolucent. When we talk about something is sonolucent, this is dark on ultrasound. So it's very important. These are some of the structures out there. So this is just, as I've showed you before, this is just showing us. So this is showing us some of these echogenicity, the very bright ones, echogenic. And we have the anechoic, for example, ultrasound, the urinary bladder is usually one of the commonest structure that shows anechoic. Ultrasound, the bladder does not reflect echoes. Fluid don't reflect echo unless the fluid is not clear. The fluid is not clear, has some echoes within it, then it can reflect. I would call that one low, some internal echoes. That's why they usually could be seen. Maybe there's blood on infection. The fluid will actually show some echoes within it. When it clear urine, usually anechoic. So anechoic means very dark. And then we have because the sound waves passes through it doesn't reflect. The structures behind it are usually very bright because all the sound wave passes through the bladder. So the structures behind it is very clear. So that is why one of the reasons why we have we need a patient. We usually have patients to have a full bladder when you want to scan the uterus. So because the bladder we have to ask, and I call it an acoustic window. Because all the sound will be passed through, and then the structures behind it we have very clear. So we have different echoes. We have bright, which is echogenic, and we have the anechoic, and in between we have the hypoechoic. This is just showing us the evolution of beam mode ultrasound. Now we have what I've been talking about is the 2-dimensional, but now we have 3-dimensional ultrasound in which the ultrasound probe can use can actually give us a coronal image that will now give us the fit of the baby actually looks like. So that's 3D. So the ones that we're talking about 2-dimensional means the ultrasound probe actually gives us only axial and sagittal images. But when you have the 3-dimensional, it gives you the coronal plane, and then the coronal plane, the machine uses it to give us a 3-dimensional image. Then now the latest one is actually the 4D fetal profile, in which you can actually the fourth dimension is actually movement. You see the baby yawning and all those ones. So that is 4th dimension. So we have 3 dimensions in which that means the machine has the coronal plane, Then the fourth dimension is the motion. You see the baby moving on scan. So these are just the evolution of the B mode ultrasound. Then motion mode is also called M mode. It's defined as the time motion display of the ultrasound wave along the chosen ultrasound line. So this is actually needed of importance and when you are measuring your fetal heart rate. So it's along a chosen ultrasound line. So this is used for measure the fetal heart rate and then also used in echocardiography. These are some of the most very important. And for Doppler imaging, this is a mode of ultrasound. Blood velocity that is flows through a blood vessel. And this employs the principle of term Doppler effect or Doppler shifts. And an effect found in all kinds of image, the sound and the sound are moving relative to each other. So I'm sure there's going to be a lecture on Doppler. So we're talking about Doppler principle. Actually, Doppler is actually used for imaging the blood vessels. And this is very important. So this is just talking about the Doppler principle. So also about time, I'll talk about that. The modes of Doppler imaging. So we have modes. We talk about scale imaging. Under scale imaging, we have the A, B, and M mode. For Doppler, we have continuous wave Doppler, pulse wave Doppler, color Doppler, and power Doppler, and so duplex. So what continuous wave Doppler? This is when the same probe uses different the probe. As we already said, as I said that the piezoelectric crystals are in the probe. The probe have piezoelectric crystals. So when there are different crystals sense. So different crystals will continuously send and continuously receive the signal. Okay, this is what is used in CTG. So it's not used, so continuous wave is not used for imaging. It's only used in cardio and CTG. So that means CTG is a Doppler image. So CTOS will continuously send and continuously receive the signal. So as an image, so if a crystal sends the signal, another crystal receives it. So this is actually the principle in cardiothoracic, cardiotocography, that's CTG. Then we have what we call the pulse wave Doppler. This one uses the same crystal to send and receive the signal. So it produces short bursts of pulses. So this is pulse wave. This is what you see. So this follows the same pulse echo technique used in 2D, two-dimensional image. So the same crystal sends the sound wave, and the same crystal that sends the sound wave also receives it. So this is what you see in pulse wave, actually this is just a wave. This is pulse wave. Then we have color Doppler. This is when you translate pulse wave into pixel of different colors. So this pulse wave that we already talked about, when it's now translated into colors, so just showing. This is just like that picture I just showed you. Structure the wave, there's wave above and there's a wave below. So it shows that structures above the scale, above the line, are actually displayed as red. That means the flow towards the transducer. When you see red means flow towards the transducer. And when you see blue, it's flow away from the transducer. So this is just showing us when you see this is a wave transducer. Then the one below the scale, below the line, is actually the flow away from the transducer. So the color Doppler translates pulse wave information into pixels of different colors, which are superimposed on the 2D image. So this is very important when you are doing Doppler. Red means flow towards the probe, and then blue means flow away from the probe. So that's color Doppler. It's just still showing us the color Doppler. That is flow towards the probe is red, and the one away is actually blue. Another that's very important when you are doing Doppler is the angle of insonation. That is the angle of insonation between the angle, is the angle between the transducer and the vessel being studied. So the angle of insolation should be preferably be at 0 degrees, but should be less than 90 degrees. And when the angle is 90 degrees, that means there won't be any frequency shift and there won't be any image produced. So this is A, angle of insolation. So you can see, this is just showing us the Doppler images, the pulse waves in relation to the angle of insolation. So when the probe is, when the angle of insolation is close to 90, you will not actually see any image. You don't see any, nothing will be displayed on the screen. So the closer the angle of insolation is to the horizontal line, the smaller the trace. That is, the closer it is to 90 degrees, the smaller the trace. Then the closer the angle of insolation is to the vertical, the higher the trace. So this is very important when you're doing. Then we have power Doppler. Power Doppler is another kind of Doppler image. This is 5 times more sensitive in detecting blood flow than color Doppler. So this is also color. It's also actually called it power Doppler. But the difference between it and color Doppler is that it gives only one color. Color like color Doppler that gives blue and red. This one gives only one color. And it's more sensitive in detecting blood flow than color Doppler. It's more sensitive. So this is actually used when we want to actually, for example, we want to see a tumor and you want to know the vascularity of the tumor. Color Doppler will detect the vascularity. It's 5 times more sensitive in detecting blood flow than color Doppler. But the only thing is that you will not know whether the blood vessel is flowing to or away from the probe. So another thing is that it is less dependent on the angle of isolation. So it's used to evaluate blood flow vessels within solid organs. So used in tumor. So we want to detect if there's a tumor is vascular. Power Doppler will give you, we actually give you, we show the vascularity better than color Doppler. Power Doppler will show the vascularity. So it's 5 times more sensitive. Then we are going to talk about duplex. Duplex ultrasound is the mode of ultrasound that combines B mode and Doppler. So when you see on the same screen, there is a B mode with Doppler ultrasound. This is called duplex ultrasound. So it provides information about the presence of blood flow in studied vessel, as well as direction. So what we call it, this is called duplex ultrasound. We are seeing the B mode and then the color Doppler. So displayed the color Doppler being displayed on a B mode image. That is called duplex ultrasound. Now, what are the measurements of importance when you're doing Doppler? You have the resistive index and the pulsatility index. And also at times, in some, you could have the systolic over diastolic ratio. It's also important in some Doppler images. Then I'm going to artifacts. What are artifacts? Artifacts are images produced that do not actually accurately reflect the anatomy of the sampling. This is very important because if you're not aware of Doppler, you can make some errors in diagnosis. So it's an images produced that do not actually accurately reflect the anatomy of the scan plane. For example, if you see this image now, you can see it's as if there is you can see like a heel of a heel, and then you can see reflection in the water. So you know that's actually, so this is actually this an artifact. Because if you're not careful, you think that this is that what the structure that you are seeing below, I think is a normal structure. So this is artifact, it's an artifact. And then, so it can be seen in both normal and pathologic situations. And some of them, talking about, there's so many of them, but we'll talk about some of them. There's acoustic shadowing, you have mirror artifacts, vibration artifacts. So talking about acoustic shadow, when I was talking about about interaction of tissue, you know, some tissues actually, one that are actually very dense, what do? They reflect all echoes. And when all the echoes are reflected, what happens? The structures, you will not be able to see anything behind the structure. This is what we call a posterior acoustic shadowing. Posterior acoustic shadowing. And this is usually seen in some structures like bone. That is why ultrasound is naturally, I said, it's not good for hair. It's also not good for bones. Ultrasound is not very good for a bone, a very high density bone, because the bone reflects all the echoes, and then it appears very bright, and then structure behind it, you will not be able to see it because all the echoes are reflected. So this is called posterior acoustic. You can see posterior to it is very dark. So this is an acoustic shadow, posterior acoustic shadow. And also very important in late pregnancy when the bone of the skull is actually very dense. It can hinder the actual visualization of some of the structures within the brain when the bone is very dense. And also the bones of the hand, and also when there is when the ultrasound wave passes through meets the bones, structures behind it will not be seen because the bones reflect all the echoes. Then we have what we call the posterior acoustic enhancement. I talked about this before. That is, I said fluid. Any structure that contains fluid does not, they don't reflect. All the ultrasound wave passes through it. And when it passes through it, structures behind it usually appears very bright. So this is important when you are scanning, especially when you are scanning when the structures are very close to the fluid. The structures will appear very bright, very bright. So this is acoustic enhancement. So area of increased brightness immediately posterior to the cystic structure. So this is acoustic enhancement. Then we have what we call mirror artifact. When a structure is displayed twice, with one be a mirror image reflector. So talking about when talking about the reflection, about interaction. So some structures, when the sound wave gets to some structures, it can cause what we call inflection. So and it passes through. This is a restructure, a relative structure. So this is actually, I don't know how to explain it very well, but they call it mirror image, mirror artifact. In this case, can see, and this is an head. This is the head of the fetus. Well, this is a reflector. So there's a reflection here, and then as it's appearing as if there's another fetus here. So this is what we call, it's actually the real fetus, but that patient actually has twin pregnancy, which is vibration artifacts. So these are usually seen in fluid when there are multiple parallel echoes. Parallel echoes.
I hope we're enjoying the lecture. I know it's quite long. And for those who are ultrasound naive, I'm sure this is the first time of embracing a lot of terms, reverberation, attenuation, resolution, and all of that. And for those that have heard all of this before, it's always good to have a reminder. And I just want to implore us to note our questions. There will be room for question and answer as soon as she wraps up our lecture. Maybe we should just have like a refresher just now. So I will just ask some random questions. You can just unmute and answer. Okay, so she talks about types of probe. Can someone just unmute and tell us the types of probe that she talked about, just to be sure that at least we picked some things this night? Can someone just unmute and tell us the types of probe that she mentioned? She showed us pictures of several kinds of probes.
And there was a curved array probe.
Ma? Sorry, can't hear you.
Curved array probe.
Okay.
There was also linear array probe.
Okay, yes, it's a linear probe.
Endocavity probe.
Yes.
Phase array probe.
Then we also have the volume probe.
Okay.
Okay, you're doing a very good job because I just asked the question now and the candidate gave me a very precise answer. So I'll just let you wrap up while we leave room for questions and answer.
Okay, so I'm rounding up now. So biological
All right,
effects.
thank you, ma.
So biological effects. So as I said, ultrasound in diagnostic range usually don't have adverse effects. So, but they actually, we call it biological. There's some biological effects that can be seen that can actually result from excessive use of ultrasound. So this is very important when you are scanning, because so biological effects, as I said, refers to the potential adverse effects ultrasound has on human tissue. And this is usually due to power, intensity, and interaction of ultrasound. Now, when the ultrasound is passing through the body, as I said, it loses energy. It loses its energy. And when the energy is loose, most time, energy is usually transferred. It's not usually lost. It's transformed, and it's transformed to another form of energy. For example, when the ultrasound wave is passing through, and the definition is that there's attenuation, what is it that is generated is usually heat. Heat is usually generated, what we call it. So that's what we call thermal. So we have thermal effects, and then we have mechanical effect. Although ultrasound has a remarkable record for patient safety, it has no significant adverse by effect reported in literature, that is in diagnostic range. Although some sources have shown that ultrasound in babies that are more exposed to ultrasound, they have some acoustic problem late in life. But this has not been actually proven, but some studies have shown that. So it's very important. So thermal effects. So usually, so as I said, the major of the sound wave, when it's passing through, it turns into heat. And so it's usually more with high frequency. And then when there's increased exposure time, then Doppler mode and increased tissue density. So these are some of actually that produces more hits. High frequency, increased exposure time. So that's why it's always important when you are not scanning, remove your probe. When you're not scanning, remove your probe, because increased exposure time can actually produce hits. And Doppler mode also can produce heat. That is why actually Doppler is not advisable to use in early pregnancy. So you don't use Doppler ultrasound in early pregnancy because of the heat that is produced. So, and this is just showing us scanning time and thermal index. So let me look. So this is thermal index. Thermal index actually on our ultrasound machines, usually on ultrasound machines. So the more time you spend on ultrasound, the more the time exposure, the more there's increased thermal index, increased heat that is produced. Increased heat produced. Then this is just showing us the heat potential. It is least in B mode. This is more when there's harmonic imaging. Harmonic imaging usually on some ultrasound machines, but not on all ultrasound machines, just enhancing the structure of the image that we see. Then M mode, color Doppler, and pulse wave. So pulse wave produces the most hits, most thermal index, followed by color Doppler. M mode is not as much as it doesn't produce more thermal index as much as color flow. So that's why color flow and pulse Doppler are not safe in early pregnancy. The mechanical effect, actually another one, is reflects the damage caused by actual oscillation of sound waves on tissue. So this actually also caused when there's too much exposure when you're scanning a tissue and you stay too much on that area. So they say there's really caused some small gas bubbles within the ultrasound fields. Although there is no biological effect that is actually that's something I have to note, that some bubbles can be produced when you spend too much time on the on the spots. So thermal index should be less than 1. Then also mechanical index should be less than 1. And one thing is very important, but there's what we call the alarm principle, as low as reasonable achievable. If it is not, if you don't need it, they don't ask for the ultrasound. Some women want to be doing ultrasound every day, but now we say there is no side
Please, you
effect.
need to wrap up now so we can leave room for questions and answer.
So that's just it. So alarm principle, apply correct examination. So just showing us. So in conclusion, we have discussed the previously highlighted objectives, the basic principle of ultrasound, how ultrasound images are produced, different modes of ultrasound terminologies. Thank you for listening.
Thank you very much. We are grateful. Thank you. It's a fully packed lecture, and I'm sure that we are ready with our questions, and she's also ready to answer our questions and clarify things for us. So please, if you have any question, you can unmute yourself now and do ask your question. Like I earlier typed, you can drop it in the chat box if you don't want to do that, but I would prefer if you could just unmute yourself and then ask your questions, please. If nobody has question, that means that we fully understand everything, and so I can ask anybody any question, right?
Some people are raising their hands. Who is Sulaiman? Elizabeth? Are they raising their hands or they're just
No, hands were raised because I told them to at some point, just to be sure that participants are still with you, ma'am.
Okay, yeah, okay.
So please, any question or clarification in all that she has taught so far? She ended with the bioeffect of ultrasound, a couple of unresolved facts about the possible biological effect of ultrasound on in the long term, the short term on the neonate. Is there any question, any clarification?
Good evening, ma.
Good evening.
Yeah, thank you very much for your presentation. The presentation very, very educative, so many things. So two things you mentioned when it comes to the penetration, the frequency, and
resolution.
the greater the frequency, the lesser the penetration. The lesser the frequency, the greater the penetration. Now, so you are mentioning about frequency and penetration. And there are different structure one I want to do a scan. And it depends on the frequency of that scan you have. Because you mentioned a woman that is pregnant, you said I think 20 or 21 weeks, if I can remember. So is there any adjustment one can do on the scan based on what you want to actually diagnose to increase the frequency or decrease the frequency? Because I don't know those probe actually has frequency they come with. But can they be adjusted to a higher and a lower for you to have a better resolution?
Yeah. Okay. Most of the ultrasound, most of the probes actually multi-frequency. Most of the probes that we have are multi-frequencies. For example, the curvilinear, some of them can be from 1, maybe 1 to 6, some can be from 2 to 5. So on the system, on the ultrasound machine, you can actually adjust. There's a way to adjust. If you want to use the higher frequency, there's a way to adjust the probe to higher frequency, and there's a way to adjust it to lower frequency. So, did you get that?
Tomorrow you're going to have a lecture on knobology. That's the study of the knobs on your ultrasound machine. And I'm telling you, it's going to be an eye-opener. You're going to realize that you've been underutilizing your ultrasound machine all this while. There are a lot of knobs there with a lot of functions that you don't even know about. So this frequency thing, it will amaze you that right there on your monitor, on the screen of the machine, as they're changing the frequency, you can see it being changed also on the screen. So please, if you can hear us, and that's the answer, and she will also type the response and put it on the group chat. Please, any other person has any clarification, questions? The floor is open, please. You can just unmute and ask a question. Thank you, Ma. So for Dr. Jallo, the response, she's responded, she's sent you the response. You can just read it. It seems you're not having a notice of a good network. Another person has a question or clarification on the lecture. That's basic physics of ultrasound. I'm wondering, someone is saying, is this really basic? It looks so advanced. Yeah, basic physics of ultrasound.
Hello, we can hear you.
Yeah.
We can hear you.
Good evening.
Yeah, good evening, ma. Good evening,
Good
everybody.
evening, ma.
Yes, I want to be clarified over, because I heard her saying that Doppler is not used in early pregnancy because it produces high heat. I don't know, and yes, I don't know whether I'm correct, but we have a different type of Doppler. We have continuum, power, color, duplex, and pulse waves. So is it all this that you can prevent using it, or which of them? Does it have a particular Doppler you need to use to stop, not to use during early pregnancy, or all of them?
All of
I don't
them.
know if you understand. I don't know if you understand
We
what
don't
I'm
use Doppler in
saying.
early pregnancy. Actually, you know, I was telling you, I showed you the. Can you hear me? I do.
Yeah,
I do.
I'm hearing.
So I
I'm
said
hearing.
Doppler ultrasound produces more hits. The thermal
Yes.
index is more. So it's not advisable to use it in early pregnancy. So M mode, there was this, I used to see my screen.
Yeah, I'm seeing it.
So this is just showing this. This is one, just safety issues. Color Doppler and pulse wave, they produce more using early pregnancy. So color Doppler, pulse Doppler, don't use it. And then you don't need continuous wave. Continuous wave is CTG. You don't need CTG in early pregnancy, do you? You don't.
Okay.
So if you want to, if anything, stop at M mode. You can measure the fetal heart. One of the things that people use for what Doppler to do is actually to see the cardiac activity. Cardiac activity, that's what you use, but you can use M mode, 2D, 3D, M mode. But as much as possible, try not to use color Doppler and pulse Doppler in early pregnancy because of the increased thermal index.
Thank you so much.
Did you get that?
Okay.
Yeah. I'm okay, sir. I'm okay, ma. Thank you.
Okay. Yeah, okay, good. So like she said, because of the bow effect and then the increased thermal index, color Doppler ultrasound generally is not advised in first trimester. We're going to have a lecture on first trimester, guideline of first trimester scan also. So I think you should watch out. You hear more of that and why you shouldn't do that also.
Thank you.
Okay, so any other person with question? Is there another question? Let me check the chat box if there's any question there. Okay, we don't have any. We have just a few minutes left. Should we still leave room for question, or I should throw to the house another bonus question? And wait for the person that will answer me. Okay, so I want to believe that today has been productive, enlightening, and then we understood most of what was taught. The truth is, by the time you start your hands-on training, most of these things, you get to use them, you get to practice them, so they stick with you better. That's all these things. You can see all those pictures she was showing, all those images. You get to put into practice all these principles that has been taught, and get to understand it better with guidance and supervision. All right, so one last question before we call this a wrap. She mentioned that the probe has something that is very, very important. Please, can someone just unmute and tell me what the name of that substance is? She mentioned something that the probe has that is very important in giving us the image, in processing images. There's something that is contained within the probe. So I'm waiting for the person that will unmute and tell me the answer. Sorry?
Piezoelectric.
That's very good. I'm seeing everybody wants to give me the answer. All right,
Yes.
so thank you very much for joining in today. We'll call it a wrap now. By Nigerian time, this is 9:30. I want to believe it's 8:30 in Sierra Leone over there. I hope we've all enjoyed ourselves today, and I hope we've learned. Please, I want us to take note because tomorrow we're going to have like a summary before we go on to the lectures for the day. Thank you very much again for joining in, and this is just the beginning, and I'm sure that it's whet our appetite already. So please, let's join in early tomorrow too. You can see that we have a lot to learn so that we can have more room for questions, more room for clarifications and answers. So thank you very much. And
I have just looked at the participants and I realized that there are two of our guys there, two of our teachers who are presently doing some work, helping to train our colleagues in Sierra Leone. And I've just seen that they are part of those who are online. I want to quickly thank our very, very dear Professor Adetunji Adeniji, who I've just seen that he's online. I want to thank him. He's one person who over the years, whenever we meet at the exams, he keeps reminding me we're working on it. We're working on it. I told him, yes, my facilitators are always ready. So, sir, I know you are with us there. I want to say a big thank you to you. I also want to thank my colleague and friend, Dr. Ezeanoche. I also saw his name all out there. He's also there helping to train our colleagues in their residency program. They are doing a lot of things, a lot of sacrifices to make sure that the sub-region makes progress in maternal and perinatal health. Dr. Ezeanoche, I want to also say a big thank you to you for all the efforts that you made to make this come to pass. Thank you very, very much. We appreciate it.